Emphysema. Emphysema is a disease of the lungs that usually develops after many years of smoking. Emphysema belongs to COPD, chronic obstructive pulmonary diseases. Emphysema is a destruction of alveolar air sacs, loss of elastic recall, and collapse of airways during exhalation results in obstruction and air trapping. When emphysema develops, the alveoli and lungs tissues are destroyed. With this damage, the alveoli cannot support the bronchial tubes. The tubes collapses and cause an obstruction or blockage, which traps air inside the lung. Too much air trapped in the lungs can give some patient a barrel-chested appearance. Alveoli secretes antiproteases and it decreases the activity of proteases. Normally in alveoli there is a balance between antiproteases and proteases. Due to imbalance of proteases and antiproteases, inflammation in the lungs normally leads to release of proteases by neutrophils and macrophages. Alpha-1 antitrypsin neutralizes proteases. Excessive inflammation or lack of alpha-1 antiproteases leads to destruction of the alveolar air sacs. Smoking is the major cause of emphysema. Cigarette smoking not only destroys the lung tissues but it also irritates the airways. This causes inflammation and damage to cilia that line the bronchial tubes. This results in swollen airways, mucus production, and difficulty clearing the airways. All of these changes can lead to shortness of breathing. Pollutants in smoke lead to excessive inflammation and protease-mediated damage, result in century insinar emphysema that is most severe in the upper lobes of lungs. Alpha-1 antiprotease deficiency is a rare cause of emphysema. Lack of antiprotease level leaves the air sacs vulnerable to protease-mediated damage, result in pan-acinar emphysema that is most severe in the lower lobe of lungs. Liver cirrhosis may also be present. Alpha-1 antitrypsin deficiency is due to misfolding of the mutated proteins. Mutant alpha-1 antitrypsin accumulates in the endoplasmic reticulum of hepatocytes, result in liver damage. Biopsy reveals pink positive globules in hepatocytes. Disease severity is based on the degree of alpha-1 antitrypsin deficiency. PIM is the normal allele. Two copies are usually expressed, PIMM. PIZ is the most common clinically relevant mutation, result in significantly low levels of circulating alpha-1 antitrypsin. PIMZ heterozygotes are usually asymptomatic with decreased circulating level of alpha-1 antitrypsin. However, significant risks of emphysema with smoking exists. These homozygotes are at significant risk for pan-acinar emphysema and liver cirrhosis. Clinical features of emphysema include dyspnea and cough with minimal sputum, prolonged expiration with pursed lips, pink puffer, weight loss, increased anterior-posterior diameter of chest, barrel chest, hypoxemia due to destruction of capillaries in alveolar sacs, and cor pulmonale or late complications.